Welcome back to the podcast today. I'm really looking forward to bringing into our conversation this week Dr. Hanna Blaney. She's a transplant hepatologist and assistant professor of medicine with clinical and research interests in alcohol-associated liver disease. Dr. Blaney, welcome, and thank you so much for taking the time to be here with me today. I know that this conversation is going to be just what my audience needs.
Thank you so much, Lindsay, for having me. I'm very excited to share my expertise in alcohol-associated liver disease, especially regarding women's health in regards to alcohol-associated liver disease. So very excited to be here.
Yes, me too. So, okay, I want to highlight today why alcohol is still so overlooked in conversations about women's health, like to your point, and really getting your perspective on this. But first, for those who might not know you, can you share a little bit about your background?
Yes, so I am soon to be triple boarded. So I'm an internal medicine doctor, a gastroenterologist, and then just completed my transplant hepatology fellowship. And so what that allows me to do is work with patients really across the spectrum of liver disease, from those that have very early liver disease and are just getting diagnosed and hopefully preventing liver disease from progressing further, to those with what we'll call end-stage liver disease, which are those patients that will die without a liver transplant. And so it's really a very broad patient population that I see. I prefer the pre-transplant patient just because that's an opportunity where we can intervene early and essentially save someone from either dying of liver disease or having to go under a huge ordeal of a liver transplant.
Yeah, by the time you're working with them, it's all very heavy. I mean, not that the whole thing is heavy, but it's completely different. So you've spent years researching and treating alcohol-associated liver disease. What drew you to this specific focus?
So I am even more drawn to the specific focus of alcohol-associated liver disease in women. I had a particular patient during my first year of medical training that was young, similar age to where I was, which was late 20s, early 30s. Also had children, and came to the hospital with essentially the most severe form of alcohol-associated liver disease, which is called alcohol-associated hepatitis. And I essentially spent my entire month of inpatient service just kind of watching her get progressively worse. And this was before we were able to offer transplant for people that had been recently drinking alcohol. And this patient unfortunately ended up passing away. They died while I was on service. And it was just it really hit me of like, well, this patient had several other kind of opportunities where she had interacted with the healthcare system. What if someone had asked the right questions earlier? What if someone had done a little bit more? Could we have prevented this young mother from dying? And the answer, we will never know, unfortunately. But since then, I've seen so many women and men very similar to this initial patient. But that was really the turning point of maybe I don't want to do just gastroenterology. Maybe I do want to go down the liver disease route, even though it was an extra year of medical training.
Yes. And so, I mean, I have a lot of questions based on what you just said. So we're going to tangent a little bit here because not only you weren't even fully into did you say you were still a medical student during this time?
So I was an intern. So that was my first year as a doctor.
Okay. So
Yeah,
early in your
very early.
career. Yeah. And I would imagine that this is also quite traumatizing for you, like a lot of work that doctors do. But I can see how this would really, this is something because it's preventable through support. And I also can just deeply relate to what you're saying because I don't know if you and I have talked about this, but my sister-in-law died from alcohol-induced hepatitis. She was in her 50s and was a daily drinker for many, 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 many years. And so I would love to understand how someone so young got to the point, because when I saw my sister-in-law, it was a very horrible death. Wasn't super slow, but it wasn't super fast either. And it involved hospice. It involved, just a lot of pain for her family. And I'm very curious, like, how does somebody so young end up with that?
So, we unfortunately have been seeing a huge increase in alcohol associated hepatitis in young women in particular. And so, I spent 6 months of last year on our inpatient transplant service. So, patients coming in very, very sick and needing urgent liver transplants. And I would say a large majority of the patients with alcohol associated hepatitis were women under the age of 50, often like 45 and below. Some young in their like 25, maybe was the youngest patient we saw last year. But typically, it is people that have been drinking kind of daily, heavier than they should for years. We used to kind of associate this condition with older men, like men in their 50s and 60s, that had been drinking for decades daily. But this shift is a few reasons. One, women are now drinking more than they historically have. And there's some kind of genetic susceptibilities that are also at play in some people. And then the biggest thing is women's bodies process alcohol differently than men, such that we'll just say glass per glass, women will have higher blood alcohol levels than men. It goes kind of directly into our liver faster as we don't have as much of an enzyme to help the process of detoxing alcohol in our stomachs. It goes to our liver, and there's a lot of processes there that lead women to develop liver disease much faster and at lower levels of alcohol use than men. And 2024, I think, was the year that in adolescence, so teenagers, was the first year that girls started drinking more than boys. So I don't think this problem is unfortunately going in the right direction. And so there's a lot of work to do on alcohol education to younger women and teenagers even.
This is so interesting that you're saying this because being my age, 46, I have friends who have teens and even young adult children. And so many of them say that their kids don't drink at all. And that age group is a little like more like, what are you doing? Why do you drink? And so this is interesting that you're saying this.
Yeah, I think in general, Gen Z is drinking a lot less than the millennial and Gen X drink. I think we unfortunately, as a whole, drink a lot more, and drinking was a much more part of our culture. So it is interesting. I think they may still be drinking less than our age group drank during that time, but we are seeing kind of the flip with women or girls drinking more than men.
Yeah, that makes a lot of sense. I mean,
Yeah.
high school was like a rite of passage to be at the party and have your whatever wine coolers or whatever it was for me when I was in high school. And so there's a lot of pressure for girls.
Definitely. And I think the other part, maybe why Gen Z, and we're, I think, still teasing this out, is there's other options. So a lot of people are using edibles or cannabis products instead, and other people just grew up during COVID years. And so they didn't have the option of going to those kind of rite of passage house parties. And so I think culturally it just wasn't as big of a thing to kind of binge drink on weekends as teenagers and college kids.
That is a very good point. Yeah, life was so much different, and there was no social media, at least for me, and I mean, no cell phones. It was, you just you got home by curfew, and your parents had zero idea what you were doing.
I kind of came of age with flip phones and the kind of analog texting.
Yeah, there was no location tracking back then. They didn't know that you're in some field somewhere with a bunch of kegs. So this is interesting. Okay. So many of my listeners, they don't identify as having a drinking problem, but they know alcohol's not helping them. They know that they don't love their relationship with alcohol. What would you say to the woman who thinks, I'm not that bad?
So I think one of the things that I will say is socially acceptable levels of drinking and alcohol use is very different from medically safe levels of alcohol use. And I get into some somewhat heated discussions sometimes with close friends and family members, as this is what I do day in and day out. And they're like, oh, I just had like 3 or 4 drinks with a friend. And like, you're kind of doing that every weekend. And like, yes, I get it. It's socially acceptable, but that's kind of more than the body, especially the female body, can handle over years and years. And so I think that people often, if they're starting to question their relationship with alcohol, it's good to listen in, try to figure out why they are starting to have those feelings, and then also just kind of learning. And I think a lot of women in their 30s and 40s in particular are at a point where our bodies are starting to change. Maybe we're not as energetic as we were in our 20s and early 30s. And so questioning those things, and alcohol has a lot of health effects, interferes with sleep, makes your skin age a little faster, and contributes to brain health. And I know myself and a lot of my friends, we're all working on trying to get healthy so we can move through middle age, into menopause and beyond, as strong and healthy as we can be. And so women that are wanting to kind of question the relationship with alcohol, I think that this is a really great time to do so. So kind
Yeah.
of a long, long answer.
Yeah, no, it's great. It's great because I think like when we get into that, like, I'm not that bad mentality, we're really just comparing ourselves to others, or we're saying like, oh, well, my friend, like I only had 2 glasses of wine tonight and she had 4 or whatever. And so just because we might not be drinking as much as somebody else doesn't mean that it's not affecting us. I never would have truly believed this, but I really do feel like no amount of alcohol is worth it. And when you are talking about a moment ago, like the way we age and our skin and being healthy and being strong, I mean, I look younger at 46 than I did at 36. And I exercise less than I did at that time as well. I mean, I exercise every day, I do something, but I used to exercise to make up for calories that I drank. And I would deprive myself of other nutritious foods in the name of fitting in the calories for wine. And these these things are not going to help us age gracefully. They're not doing us favors. And, but I know what that sort of loop, and I would literally track what I was eating in a day and put my wine in and think to myself, oh, well, I'm still under my calories. And that sometimes meant that I barely ate anything that day.
So we see that fairly commonly, especially in women that are wanting to look good and feel confident in their bodies. One thing that's also very common is kind of skipping meals or drinking alcohol, like a cocktail or a glass of wine on an empty stomach. That's actually worse for your liver than eating it with food, just because it's kind of all at once. But a lot of women will do that. And the liver is I call it the factory of the body. And so it really needs good nutrition and good kind of substrate or building blocks to do all of the wonderful things that it does for our health.
I love that. The factory of our body. I'm going to start using that in my content. I will quote you on it. So, can liver damage then or dysfunction happen even if someone isn't drinking every day or getting drunk or intoxicated regularly?
Yes, so very interesting. So, the amount of alcohol that the female body can safely tolerate, and everyone's a little bit different, but on the population studies of thousands and thousands of people, the risk for liver disease really starts at 1 drink a day for women. And that's typically over years, but really going over that 1 drink a day really puts you at increased risk. And every drink that you have over that also increases the risk. And as I was talking about a little earlier, whether you're drinking on an empty stomach or with food, that's going to affect, as well as binge drinking. So having like 3 or 4 drinks on a weekend, even though you're, again, in like a social setting, and I think that's completely normal for a lot of people, that can really stress out the liver. And so you can see damage. I want to just bring up one thing that I think have caused a lot of harm. In the early 90s, you probably remember on national news, they were promoting drinking red wine. So it's like a glass of red wine a day is good for your health. We're still seeing this, even though it's been disproven over and over again. But I have seen a lot of people start drinking red wine to essentially get the health benefits of it when it's just increasing the risk of liver disease and various types of cancer.
Yes, yes. So I recently read an article on this, and I don't recall where I read it, but there is the ingredient in red wine or something about it that can be beneficial, but the amount of red wine you need to drink to actually have that ingredient be effective is going to trash the rest of your health.
Yes. Yeah. So, I mean, it's essentially plants and their phytochemicals and like antioxidants in kind of bright colored fruits and vegetables, which you can just eat the fruit or vegetable. And maybe have some fermented food benefit as well with adding some kimchi or sauerkraut or something like that rather than drinking fermented grape juice. But yes, you'd have to drink a huge amount of red wine to get the antioxidant benefit, which at that point you're causing so much damage and stress that it's not worth it.
Yeah, it kind of just sounds like another way for us to justify drinking and rationalize drinking. There really is no rationalization to it. I feel like that alone is a topic that we could probably go off on, but I will keep us moving. What are early signs, whether this is physically or internally, that might signal alcohol is starting to impact the body more than we realize? I feel like for a very long time in my drinking, I kind of thought of myself as invincible and this was never going to be a health issue for me. But then I always would look at my mom. She was a daily drinker. She had lots of health issues. And I kind of reached a point where I was like, I think that's my future if I keep this up. And I don't want that. So, what should people be looking out for?
So, honestly, for liver disease, it's kind of like a silent disease until it's not. And so it's diagnosed 12 times later than other liver diseases, like hepatitis C, for example, just because we aren't good at screening for it. And it's essentially often silent until it's not. Fatigue would probably be one of the first signs that you would see. But most of the time, it's just like, oh, your blood pressure is a little bit high, as alcohol can kind of raise your blood pressure. Or it's going to be, oh, your liver enzymes are just a little off. And what's interesting is the labs, so the reference values where you'll have the red arrow pointing up that says high on most blood tests are actually inaccurate. And so a lot of times it's missed, and a lot of doctors that are not liver doctors don't realize because we were always kind of told that liver enzymes in the 30s and 40s were normal, or really for women, we really want those enzymes to be like 20 or less. And so a lot of times it can't even be missed by well meaning and otherwise well informed doctors, but it's kind of subspecialty knowledge, and a lot of labs have not updated those reference ranges.
Yeah, so we really have to be diligent and question the data that we're seeing. And it's scary to question your doctor. People don't just do that, maybe getting a second opinion on something. But if things basically appear normal, you're not going to question that.
I think that if the doctor's not really wrong, and I think if you say, well, I heard from someone that liver tests in women really should be 20 or less, I think the doctor will say, like, yeah, maybe I have heard that. Let's take a second look. I don't think the doctor is going to really get mad that
Yeah.
you're kind of like questioning and doing your own research. We always want informed patients.
Yeah. Yeah. No, I know. I always go to my doctor with my checklist. And there's always a lot of comfort there. I think she's okay with it though. I think what I love is when you talk about fatigue, because fatigue is very easily justifiable. And I think that something that I talk to people about a lot is that when you're a regular drinker, you don't even realize that you're only operating at maybe 40, 50, 60% because you've just become used to it. And I think as women, we are so used to doing the thing anyway, whether we're tired, whether we're sick, whatever, that we
Yeah.
become used to operating at that level. And so I'm wondering, like, how does one get to the point, or how often do patients come in and actually say, my one symptom is fatigue? And because I don't know that I would feel confident to go to my doctor with that. And I would never want to blame it on my drinking. I would blame it on a list of 10 other things before I said it was because of my drinking.
Yeah. So fatigue, it can be due to so many things. It can be just due to poor sleep, which alcohol destroys your sleep architecture. It can be from like hormonal issues. It can be from anemia. It can be from so many things. So it's very non-specific. But that is something that I would say that most patients with liver disease, that's kind of the first symptom. Like, I'm just not really feeling myself. I'm kind of tired. So it's hard. And most of the time they're going to look at everything. But the big thing is just getting the full, what we'll call the metabolic panel, which has the kidney test, the electrolytes, the liver tests, as well as just like a complete blood count to make sure there's not anemia. Also looking at the platelet count, which can also be a marker for more late stage liver disease. Often that's where we find it with a low platelet count that maybe has just been trending down over years. But yeah, it's a big issue just because most of the time liver disease, just kind of like high blood pressure and diabetes, they're pretty silent.
Okay. The other thing that is you're bringing up for me right now is that women, this isn't just women, this is everybody, I think. Whenever we say, for example, have a upcoming doctor's appointment or we have some blood work that is looming that we need to get done, many women come to me because they they feel like they need to take a break because we all lie to our doctors about how much we drink. And until we have to start telling the truth because of something like what you're describing comes up and we're like, oh yeah, by the way, actually I've been drinking a bottle of wine every day for years. And they're like, no kidding, I can tell by looking at your liver results. But it's like they come to me because they're afraid of getting that blood work and they want me to help them, take a break, whatever it is, from drinking. Are there routine tests and screenings that you believe more women should be aware of or requesting if they've been drinking regularly for years? And as a doctor, what do you want to say to the woman who doesn't want to go and do these because she knows she's been drinking too much and she's embarrassed or just scared of the outcome and doesn't want to talk to her doctor about it?
I'm going to start with the first test question. So, getting the complete metabolic panel with the liver enzymes and then the CBC, which is the complete blood count. With the platelets, that allows us to take a look and kind of decide whether you're really low risk for liver disease or higher risk. Sometimes we'll follow that with an ultrasound. And then one of my favorite tests is something called a fiber scan, which essentially shoots a sound wave through the liver. It measures the amount of fat in the liver. Is alcohol one of the ways it damages the liver is by putting fat into the liver? And then that fat causes inflammation, and then that inflammation over time leads to scarring, and over time that goes to cirrhosis. And so that's something that can be picked up on the fiber scan, or the fiber scan, it puts out a number so we can kind of grade how bad that is, where the ultrasound just is like a yes, no, it's there or not. And then the fiber scan also tells us how stiff or scarred the liver might be. And so those are the tests that I like to figure out how worried I need to be about someone's liver, especially someone with risk factors like drinking heavily or those that have other metabolic risk factors, as we see a lot of what used to be called fatty liver disease.
Yeah, yeah. I think that's a term that probably people know, or I'm familiar with it. So I'm assuming other people do. So, okay. Yeah. So I want to make sure, I just want to point this out to the listener. We will link this list or include this list of testing and screening in the show notes. So you can just write it down on a little list and take it to your doctor the next time.
Great. And then the second question you have for women that are maybe afraid to go get the blood test. Honestly, I think information and knowledge is power. And so knowing whether you have a liver disease, it kind of tells you really how aggressive you need to be on making lifestyle changes to kind of get ahead of it and prevent it from getting worse. Your doctor is there to help you. We are not going to judge you. I've had so many people that literally drink like a 36 pack of beer a day. That's an enormous amount of beer. I appreciate when those patients tell me because it allows me to figure out how I can help them essentially reach their goals of being healthy. And that often involves drinking less. So there's really no shame at all. We really, I mean, we do care if you're drinking. We want to know and be able to kind of put your whole health into context. But we really are not going to judge you for that. As we're really here to help.
Yeah, yeah. And it is scary. And everybody lies to their doctor about how much they're drinking. I mean, not everybody, that's kind of an absolute, but many of us do. And I know that I did. And when we don't get the information, then it's like that ignorance is bliss piece. And then we just keep going. And then that's what makes it get worse. And if you're listening to this episode, you're already thinking about your relationship with drinking. And so, don't wait. Just do it. Make it be your one bold move that you make in this journey and say, you know what? I'm going to be honest with my doctor. I'm going to go get the tests. I'm going to put my brave face on and just do this thing that feels really scary, but I know is going to help me.
And I want to just bring up one thing. Finding liver disease, especially if we're able to find it in the earlier stages, we can actually, if we essentially intervene and help that patient stop drinking, get their metabolic health under control. So that means like controlling any diabetes, losing any excess weight, those things. Most of the time, we can see liver disease go away or get a lot less worse. So we can take it from like a 10 out of 10, really scary, to somewhere between anywhere from like a 1 out of 10 to maybe an 8 out of 10. The liver is a really amazing forgiving organ up to a certain point. Empowering yourself with those blood tests, figuring out how bad the liver disease is, that's kind of point A. Point B and C is going to hopefully look a lot better, especially if you catch it early.
Yes, exactly. And so, okay, this is the direction I wanted to go in. So, one of the things that I focus on inside my coaching is giving women, this new path forward and not just quitting, but healing and saying, this is how I'm going to take care of myself. And I wanted to know, like, what is the potential for liver health to recover once alcohol is removed or even reduced?
So, 90% of people that have a few drinks a day over a 2 week period, so it happens pretty quickly, will develop steatosis or fat in the liver from alcohol. But stopping alcohol and remaining abstinent for 4 to 6 weeks, the liver completely goes back to normal. And so it's really an amazing organ.
So, I mean, there's good news. Our livers are resilient.
And even at like very end stage, so the person, for example, I've seen pretty amazing transformation. So someone that is bright yellow with a belly full of fluid that we are considering for transplant. Maybe we even list them for transplant because we think that they may die without a transplant. Maybe something happens, they get pneumonia. For some reason, they don't immediately get a liver transplant. Sometimes they will actually get better, their yellowness will go away, the fluid will go away, and then they can live a near normal life after. Typically it takes about like 6 to even 12 months to kind of completely recover from an intense episode like that. But even the kind of the sickest of the sick can go essentially almost to complete recovery. They'll still have often scarring of their liver, but with just stopping the toxin in this case, which is alcohol. I do want to highlight that really any stage of liver disease, stopping drinking will typically take you a few steps back towards health.
In the good direction. So, I'm wondering if you've had a patient or have you personally witnessed in terms of transformation or recovery that has really stuck with you?
A woman that I cared for that was kind of in the uh, near death phase of liver disease from alcohol associated hepatitis. Also, a fairly young mom um, that you would never really like well off family, a successful woman, ended up near death's door with liver disease. And she was in the hospital for like 3 months. We kept thinking that complication after complication, kind of kept thinking that she was going to probably die. But she was somehow able to hang on in that 3 months of forced sobriety in the hospital. And she actually was very committed to sobriety as well. But she got a really good head start with just kind of being away from accessing any alcohol.
Yeah.
But she got better. The fluid went away, her skin looked normal. But when she got out of the hospital, started eating more protein, gaining back weight, and was able to avoid transplant as one of those people that you would see out at like Whole Foods and you would never ever know what she went through.
Yay, go her. And unfortunately, that's not everybody's story. And I would imagine, like I do with some of my clients, that you get really attached to the outcomes of these patients. And I'm wondering how do you manage that? I know we didn't quite talk about this avenue, but I'm wondering like how do doctors or you, I know you can't speak for everybody, but how do you handle that stress of not becoming too attached to the outcome of your patients?
I think we are very attached to the outcome of our patients, but I think over years of, especially kind of the training that we go through with internal medicine, we really do kind of get used to dealing with life and death situations fairly regularly, even more so in liver transplant, just because our patients are so sick. And so we're so invested, we get really close to the patients and their families. So it does hurt personally when something doesn't go right. But for every patient that doesn't have a great outcome, you have several that have essentially new lives. And so it's really rewarding work. And we kind of focus on the positives. And obviously, when someone, often the whole department gets to know these patients. So when someone does die, it's kind of a group mourning and grief, but you just have to move through it and see all of the other patients that need you.
Yeah, because it's not going to be the last time it happens. And it's just really mentally preparing for those moments. And you have each other, you have a team of people.
Yep.
So I can see how that would impact so many people. And all of the work that you do is so incredibly important because it's not just the patient, it's their loved ones and their families. Okay, let's go. We'll bring this fully around the block here. Why do you think that alcohol is still so overlooked in conversations about women's health? And what needs to change? What do we need to be doing?
So I forgot exactly the percent of breast cancer that is related to alcohol use. It's high, and it's surprisingly high. I think we just need to have more attention that alcohol is not like a health elixir and that it's actually harmful, as I think a lot of people do think there's still health benefits to it. I think we need to just get away from that, and I think we need to do better as doctors at destigmatizing drinking, so our patients don't feel like they need to lie to us about how much they're drinking. We know that happens. It's well documented in literature, but we really want to help everyone, and so I think that's something that we need to do. And so alcohol is not just a liver disease. It's not essentially just a brain disease. It affects multiple organs. It's a whole, as well as social life, family health. It really kind of hits every aspect of life. And so I think we do need to bring it into the spotlight a little bit more and then have people just feel a little bit more comfortable bringing it up and saying that, yeah, maybe I am drinking too much and maybe I do need a little bit of extra help to get away from this drink that I grew up in a household where everyone drank alcohol. And then I grew up with friends, and alcohol is just kind of like the central point of most social gatherings that it's so embedded. And so it's really hard for us to get away from it. And kind of on that tangent, I love the mocktail culture. I love that it's becoming kind of more socially acceptable to not drink. And so I think also just like not peer pressuring, like, oh, why aren't you drinking? You kind of like assume that like, oh, this person must be pregnant if they're not drinking. And like, no, they just don't want alcohol for whatever reason, and that's okay.
Yes. Yeah, the peer pressure, I think, is something that we all worry about and fear, particularly when we're putting a little spotlight on ourselves and our relationship, and we're trying to make this big change. And so we already know that what we're doing is different than what other people are doing. And so it's just, there's so much awkwardness around it. And it's like, people don't care as much as we think they do about us drinking. And I'm with you. I love the mocktail culture. I wish it was around many, many years ago because it makes things more acceptable. It's just all very, it's just it's everywhere. Like you were saying, alcohol, the reason why it's so daunting to address our relationship with alcohol, because it isn't just about, the woman who drinks on the couch at night to relieve stress, or the wedding that you go to and maybe you overdo it or whatever. It's in every area of your life. It's in traditions, it's in family gatherings, it's in how we celebrate, it's in your day to day. So, of course, it's daunting to think about drinking less because it's hard to figure out where to start.
Yep. And learning coping skills for stress is a lot of people have that glass of wine when they get home, when they're cooking dinner, to kind of like break work and home life. I feel like that's extremely common with both men and women, and finding something to replace that and all of these rituals that we've created for ourselves and society has created for us. It's hard to break those habits and traditions.
Yeah, it is. It's my favorite part about the work that I do with women is around like, let's just pick a couple of things that are going on in your life and we'll start changing those. And you don't have to worry about, burning your whole life down and building it up again. We can just make little changes and they'll all start to click together. This has been very interesting and very exciting for me to learn more about you and just in general, the fact that we can turn things around here. It could be a diagnosis, but not a prognosis. Is that maybe a good way to say it?
Yes, I think it's really from a health standpoint. It's never really too late to have a benefit from stopping.
Yeah, yeah. And I mean, I've seen that too. I've had women who I work with who are in their 70s and now they're a year sober, a year plus sober, and they're living like literally living their best lives. And they didn't think it was possible. There were times in our work together where they thought, this just there's no point, but there absolutely is a point. Like if you are in your 50s, 60s, 70s, you have 30, 40 more years left on this planet. Like, do it feeling amazing. So, okay, let's come to a close here. If you could leave one message with this high functioning woman who has everything in her life together on the outside, but she maybe feels uneasy about her drinking, she kind of knows she should do something about it, what would it be?
I would listen to those inner voices saying maybe this isn't working anymore, just because there are so many benefits of staying away from alcohol. And if you're already kind of thinking like this is not really healthy in my life, it's probably affecting your body and your health and your mind in more ways than you can actually realize with that little thought that's coming into the head.
Yeah, yeah. What do you think you would recommend they do as a first step? Just would you say contact their doctor and get these screenings done and just be open and honest?
So I think that's definitely part of it. But I think kind of really like being real of like, is this something that I can do completely on my own? Most people may not be able to. Some people like having a coach can be very helpful. Sometimes going to groups like AA, I feel like a lot of women in particular don't love those sorts of groups, or just kind of being open with your doctor so we can kind of monitor you and kind of be there to help you if any extra help is needed. But I would not really recommend doing it completely on your own because it can be, I think, a little bit isolating. And most people do need some sort of help or support.
Yes, exactly. Alcohol pushes us into isolation and it causes us to just feel so incredibly alone. And I agree 100%. Like, do not do this alone. And starting with your doctor might be the right move for people. I also, something that I talk a lot about, because the women that I work with are more of, they're gray area drinkers. I do sort of some questions with them to understand if they would need like a medical detox. And so, because I don't work with women who would require that. And how would you say for somebody to like get their first inkling if they were like chemically dependent on alcohol versus can just, it's okay if tomorrow you don't drink?
So the chemically dependent, there's a lot of kind of outpatient protocols that if we're worried about you going through a withdrawal, that we can help mitigate that and make it a lot easier. I think those that are like have a chemical dependency, alcohol withdrawal is one of the few withdrawal, really kind of the only withdrawal that can actually kill you. Doing it safely, if you're someone that has been drinking heavily and has like never gone a day or two without alcohol, or you'll get withdrawal, definitely want to be under the care of a doctor that
Yeah.
can either do an inpatient or a monitored outpatient with kind of safe medication to
Yeah.
help you through that.
Yeah. So it's not scary to talk to your doctor. They want to help you is the message.
And then the other thing is there are medications that can also benefit people that are, if they have just so much noise about drinking, that can kind of help quiet those noises and cravings. And I just want people to be aware of those and not be ashamed if they need a little bit of extra help.
Yes, yes. Oh, thank you so much, Dr. Blaney. This has been so good. I love this conversation and I love having your expertise on the podcast because this is what women need to know. This is the reality of what is going on with our bodies from drinking. And take the step, contact your doctor, start with a break, do the thing to just advance you forward in your journey.
Well, thank you so much for having me, Lindsay. I really enjoyed discussing this with you today.
Yes, me too. And we'll do a follow-up sometime. It will be amazing.
Great. Look forward to it.
My hope is that this episode helped you feel a few things, but less alone, of course, and a sense of safety in taking your health into your own hands and maybe reaching out to your doctor, maybe taking that next step towards living this life, because I didn't want to scare you with this information that Dr. Blaney shared today. I wanted it to be this like big green light for you to say, it's not too late for me. I don't drink too much, or I can change this. This is something that will value me from a health perspective, a longevity perspective. So that's really what I was hoping that you got from it. I hope that you enjoyed listening to it as much as I enjoyed the conversation with Dr. Blaney today. If you loved this episode, please rate it. Please leave a comment. I love hearing from you. I definitely want to know what you think of the podcast, and also share it with a friend. Let them know, hey, we're taking a break from drinking and this is one of the reasons why, one of the many reasons why. So share it with a friend and rate the podcast, subscribe to the podcast. It helps other women who need it and need support find it. Okay, that's it for me this week. I will see you next week on the podcast, and I believe in you. I cannot wait for next week's episode, by the way. It's going to be good.